Good morning, everybody. Can you guys hear and see the stream?
Yes, we can. Morning.
I appreciate it. Thank you. Hope you guys are having a great week. So this is part of our Humanities in Medicine series. Part of our education program is to not only train people in urology and related skills, is to really prepare them to function effectively in the environment our residents or fellows to go and find them. And as we live and work in a complex environment, it is important that we are able to communicate well with each other. And one of the fundamental mechanisms that we communicate with each other is this thing called feedback. So,
Zoom. Enter your meeting ID followed.
So the feedback is a continuing process. This is necessary for any system to work properly. And what it does, it helps with improvement. It helps with education. It is very important and critical for effective and good communication. The key thing about feedback, the intent is the key. The key here is this is for everybody's betterment. What is feedback is not about retaliation. It's not about gotcha, I don't get my way, therefore I'm going to give negative feedback. It's nothing like that. This is actually a process that happens every day where we are trying to look at the environment we are working in, the people we are working with, all the situation, and saying, what can we do or say or communicate to improve this whole environment that we work in or produce better outcomes. And I think that's the goal of a feedback. And it's a very, very constructive process. And what I'm going to do now is hand over the mic for a minute to one of our own who's been willing to be a sport and tell us about their experience about having a feedback and how that has really helped us to improve. Amy, do you want to take over for a minute?
Can you guys hear me?
Yes, now we can hear you, Amy.
Sorry. So if there's anybody on here who doesn't know me, my name's Amy Busick. I'm one of the physician assistants in the department. And if you guys can't hear me, just let me know. I'm in the car. So, hey, so Dr. Balaji just wanted me to talk for a minute or two and share a positive experience that I had with feedback a couple years ago. So Dr. Balaji approached me a couple years ago to let me know that some of my coworkers had some concerns about the way that the impression that I was giving to them, that I was coming off as being very unapproachable and standoffish, which of course was not my intention at all. So I took that feedback and worked very hard to try to change that. And I don't think there's been any complaints since. So if he hadn't have told me that, I would have never known it was a problem and been able to do anything about it. So that's what I have.
Thanks a lot, Amy. Yeah, thank you, Amy. It's really, when I approached Amy about this yesterday, I was a little bit shy. I didn't know whether this is something she wanted to talk about. She didn't hesitate. She just said, yes, please allow me to. And I think that's the important thing. There were a couple of things about Amy's experience. First of all, my interaction with Amy all along has been superb. So I wasn't even aware there were issues with Amy. Then I started getting feedback from multiple sources about something very similar. So when I get somebody say something about, it could be about a person, it could be about a situation. If it's one person, then it can just be, it's one-off thing. But when it's consistent, when there are multiple sources giving me similar information, then a pattern emerges. Then the key thing about leadership is not to judge, because unless we have had a full opportunity to investigate, to verify, and then give feedback to the person, what I've learned is 99% of the time, the problem can be solved with constructive feedback. Because most of the time, the reaction I get is the reaction I got from Amy. She just did not know. She didn't know that she was coming across that way. She wasn't even trying to be. In fact, she was working hard. And then once I gave that feedback to Amy, Amy did beautifully. First is she was not defensive. She understood giving a feedback like that. And especially Amy and I, we work well together. We get along well together. It is uncomfortable for me to tell Amy anything but positive. But I also couldn't hold the information back from her because it was not fair to her, because this is something that's going on and people are letting me know. And then, so when I told her, she made me feel at ease. She said, thank you for letting me know. Of course, this was done very privately, and Amy and I have never shared this outside our conversation over the last 2 years. We are doing this now as a matter of education for everybody else, okay? I was very uncomfortable. I didn't know how Amy would take it. But Amy made me feel at ease, and she said, thank you for letting me know. And we were also very specific. I did tell her exactly what was going on and why she was being perceived that way. And we also talked about what she could do to change that perception. So she changed it. And I can tell you, the last 2 years, there have been multiple people that she has worked with, her peers, her extenders, MAs, faculty. Not a single person has said anything negative about Amy to me till now. It's just a dramatic change. It's just to tell you, as long as the intent is good and we are able to give constructive and specific feedback to each other, then this would be a very successful place. All of us will do really, really well. The next I'm going to talk to you guys is multiple things about feedback, okay? We already talked about why feedback. It is constructive, it's necessary, it has to happen all the time, okay? Then we are going to talk about the various other aspects. When, what, who are the participants, how do we do it? Why doesn't feedback happen as often? What are the barriers? And what do we do when feedback doesn't work? Okay, cannot have success all the time. Then how do we escalate it to the next level if feedbacks don't work? So we'll go through all this in detail. And, these are important aspects in management, but I really think this is also very important in terms of functioning as an effective team. So when should feedback happen? Feedback should happen as frequently as possible. Now, one of the best places I find feedback happens beautifully every day is in the operating room, okay? When there is something about the operating room that feedback is built into the culture, okay? And feedback is given back and forth all the time. We don't even realize that's what we are doing, but we do it because it's ingrained in our culture. Both the giver and the recipient are very open to feedback in the operating room. We operate, I'm not sure what to do next. Yesterday we had a couple of difficult robot cases. I was talking to our residents and fellows, guys, should we do this? Should we not? And they gave me feedback. They said, look, yes, it's difficult, but it's not something we should back out at this time. Let's do it. And that forward and back. And the same thing, residents are doing something. I'm giving them feedback. I think you did this well, but this is a better way to do it. And the residents are very receptive to that feedback. The attendings are very receptive. Anesthesiologists have had concerns. They came and talked to us. We were receptive. So it's an extraordinarily healthy environment where there's feedback is ingrained in our culture. What happens in the operating room? We give feedback as frequently as possible. It's also done as soon as possible. It's very timely. And then, if something is happening in the moment in time, we talk about it right away. If we see something, we say something. This is the whole the TSA adage when you go to the airport. You can't see something, have a thought about it, and then not say anything. That's why we have all the timeouts. We encourage people to speak up if they see something, and that's what feedback is all about. Now, there are several situations feedback needs to happen. So I have broadly categorized them into 3 C's, okay? Feedback can be very positive. If you want to congratulate somebody, don't wait. Say thank you. Say that this is a great job. Hey, it really went well today. Whatever the positive is, and that's the feedback. So that's a positive feedback that tends to reinforce people. So they've done a great job. Somebody has noticed it. Hey, the clinic went well today. Thank you for organizing it well. Hey, patients were happy. They came in and out quickly. It makes a big difference to the MAs who do the job that they've been running around and been thinking about this busy clinic they have to get to. Okay, anything you want to congratulate. The second thing is change. We talk about change all the time. Change is the only constant. We cannot get comfortable in our own shoes and then just let life go on, because change has to happen, because we always can be better than where we are, and change has to happen. And change is not easy, and change is going to be difficult. There are going to be resistance to change, but there are ways to do it, and feedback is a very important component of change. And also, when change is happening, then we need to get feedback about the change itself so that we can change the change, so that we can say, well, we are trying to do this. It's not working as well we thought. Let's be more dynamic. Let's be more robust. Let's change the path we are doing. And then, of course, every time we are trying to make a change, there are going to be people who are going to resist it. There are going to be ideas that will hold on. And you just need to be able to navigate. And all of this can be done very effectively and peacefully through good feedback and good negotiation. The third thing is concerns. We often use feedback when there are concerns, which I think is a healthy way to handle it, because if you're concerned, we can't just be passive about it. We have to say something, and then hopefully the concern will be addressed. But we also have to remember, feedback is just not about concerns. It should happen when a congratulation is in order, when we want to change something, or we are really concerned. Then, of course, we need to give feedback. Now, my talks happen to be monologues, so feel free to interject, ask any questions. And I also realize these are relatively dry topics for urologists, but nevertheless, I think it's very important that we kind of have talk about these kind of topics, because these are skills that we use every day in our jobs, and it's very important that we have clarity. Now, what are the issues about which feedback is generally given or needs to be given? Again, these are broad categories. There's a laundry list of things we can give feedback about. But as I was trying to put this talk together, I was trying to crystallize the thoughts in my mind into broad buckets. The feedback that's often given is about behavior. This person did that, that person did this, or they could have done this differently, better, and so on and so forth, which is all very reasonable, because if there is a behavior issue of a person, and especially when that behavior is affecting the teamwork, if that behavior is disruptive, then that has to be addressed effectively and promptly, okay? And most of the time, feedback is all that's necessary. If I give a feedback to this person, look, I don't think you intend to do it this way, but this is what I'm hearing. The challenge becomes when it turns into an argument. Then it becomes a challenge, because then I'll talk to you about barriers for feedback and how we need to address them. But the common feedback we give is about behavior. The second thing is about attitude. Now, this is hard to pin down. We all have to realize in every portion of our jobs, there is busy work to do. Let me give you an example. I've been busy. I haven't really had much administrative time the last few weeks because we had to catch up with a lot of cases. So when I went into my administrative task yesterday, I had to sign off on about maybe 15 leave requests. It's a busy job, okay? But I have to do it with the same fervor I would do maybe a robotic surgery, because for that person, the time off is important and we need to approve. There are busy jobs in every busy portions in all our jobs. So then it becomes an attitude. We cannot have a weak or poor attitude to a job that is busy and not as exciting to us. We just have to maintain the composure and the same attitude. And when we don't have the right attitude, other people can see it. And that's the important thing. You know, I don't want to say, come to the clinic and do something. I'd rather be doing robotic surgery. Whether you like it or not, it has to be done, okay? But then if you come to clinic with bad attitude, it'll be obvious to everybody else. So that's why, and if that attitude occurs, then we need to have a feedback. And the person may not even know, it may be subliminal, okay? Then we tell the person, look, I know you're working hard on all that. A little bit of smile will go a long way, you know? And so it's about attitude. Teamwork. We cannot do anything without teamwork. We are collective, we are not individuals here. We are just put a team together. And the thing about teamwork, what I've realized over the years, it takes a lot of hard work and it takes a lot of team members to pull something off. It is just true teamwork. All it takes is one individual, one bad behavior, one bad attitude, one toxic thing that will just destroy the whole team. And I have seen this again and again. So part of being a leader is to be able to recognize when something is disruptive, when something is turning into a toxic behavior that can be potentially disruptive to the team. And initially, of course, when we recognize this or when we even perceive this, then feedback has to happen right away. And often all that we do is turn to the individual and say, guys, you're doing a great job, you're doing well, but this particular asset is raising some alarm and concern. And a proper individual will take that to heart. It shouldn't be any more effort than that, okay? If somebody has taken time to come and tell me, you know, Casey, you're doing this job right, but I'm really concerned about this, that's all I need to know. And then I will start the reflection process and see what I need to do. Then we can talk about the situation. It doesn't have to be about an individual. You know, it could be the sterilizer that's breaking down in our clinic. You know, that is a concern. Not having a cystoscope to do a job is a concern. Then that merits a feedback and give feedback to the person who can take care of it. And of course, in our model, I'm always available for you guys to come and tell me, but it doesn't have to be at my level. You can talk to, if the sterilizer, if your cystoscope is not available, instrument, talk to the clinic manager or office manager who can help you with it right away. Then environment, if you find any hazards, you know, that are on the way or anything that concerns. And of course, resources. If we cannot do a job without the resources we need. And if you're short on resources or if we need additional resources, then feedback matters. So just reflect on all this for a minute. If we are all encouraged to give feedback of any of these issues, you know, you don't have to put up with a bad situation. You should not be put in a difficult environment. You should not be resource strapped. You should never tolerate bad behavior, bad attitude, and anything that's remotely disruptive to teamwork has to be addressed with feedback. So feedback is a very constructive tool. And most of the time, when we give feedback to that other person, the reaction 9 out of 10 times I get is, sorry, I didn't even know that. Thank you for letting me know. And they address it. It's that simple. That's why I think feedback is one of the most constructive and effective tools available to any organization. Any questions on this so far? So what kind of feedback? All of us like to and enjoy getting positive feedback. But sometimes feedback may not necessarily be so positive. We have to take both equitably, you know, with equipoise, because sometimes success doesn't help us to improve as much as failures do. And because it's only when we fail, we reflect harder and deeper and say, why did this happen? What can we do better? You know, it doesn't mean we shouldn't have success. It doesn't mean we shouldn't have positive feedback, but we just have to be able to train our minds to take with equipoise whatever feedback we get, because every feedback is a wonderful thing and we can learn something from it. Just because it's not so positive is not any less valuable than the positive feedback. Now, feedback has to happen between all of us to each other. There's really, if we have a big team, we have variety of staff doing variety of functions, and it's a matrix model. We all interact with each other throughout the day. And therefore, we have opportunities to work with other individuals. We work in different environments, work in our clinic, we work in the emergency room, we work in the operating room, work in inpatient setting, and we do academic work. So our environment is complex and we interact with so many people. So it's important that we give feedback between all of us. We should be able to give it to each other, and it's 360 degrees. And this is the key thing. There's no hierarchy. All of us are doing a job, and we all know there's always opportunity for us to do our job better. Okay? It doesn't matter, it's the CEO of a hospital, to the dean of a medical school, to a chair of a department, or the president of the university. Everybody wants to do the job better. And then everybody can only do the job better if we can get feedback from others. And so that helps us to identify things that we cannot see for ourselves and other people are able to see. And then we can try and improve. One of the things as a leader I'm undergoing now is coaching, because there are always opportunities to be a better leader, as you think. And as I sit with my coach and go through various situations and say, if I'm in this situation, what is the best way to handle it? The coach doesn't necessarily tell me what to do, but the coach it's like a therapy session. They sit with you, okay, what would happen if you do this? Why would you or would you not do it? And helps me to walk through this. And currently, you guys may be getting a call from my coach. We'll do a 360 evaluation of my performance as a leader. And the goal of that feedback is so that I get feedback and I can improve. And I'll talk to you about seeking feedback. And this is a very important component of feedback itself. So there's literally no hierarchy. All of us need feedback. We have to do it as often as possible. And always the intent has to be to make the situation better or make that person better. And I think that's the key. Now, how is feedback? How does it actually happen? So we have the giver, we have the receiver, and it is generally better to have a listener in the room. And I tell you why. You guys see, when I meet with you and talk to you one-on-one, unless you request me to do so, I would usually have a third person on the call. I usually have a third person in the room. And generally for any feedback, unless it's a feedback on the curbside, hey, you're doing fine, and things like that. And the reason for this is not a defensive strategy. As we talked about in our workshops, the big risk we face anytime we try to communicate, it could be in writing, in talking, and so on and so forth, is the risk of misinterpretation, because we are writing a particular way and the reader interprets it differently. We are trying to say something and the person hears something else. So, but having a listener in the room, what this does, and I couldn't tell you how many times that I have given feedback, or it could be a business meeting, we have discussed something and something else happens. And then I'm thinking, we met and we decided to do something, but I'm hearing something else is happening. Then I go back to the listener and I said, didn't we discuss that? And the listener would tell me, I heard something different from what you're telling me. And then that gives me feedback that the way I communicated should be better. Because if there are 3 people in the room and I'm saying something, and then the listener and the receiver, I've heard something different, that means that the way I communicated needs to be changed. So this is a very important educational process. So if you're going to give some complex feedback or not so positive feedback, it's better to have a listener in the room. And this is helpful. I mean, these are all, 101 in business. We get trained in all this. So this is something I find very, very useful, to have another person in the room. And of course, when I have another person in the room, if I'm the giver, then I would I would check with the receiver whether it's okay to have another person in the room. Because if the receiver is uncomfortable, then maybe it has to be a one-on-one conversation. But if the receiver is okay with that, then I would prefer to have a listener in the room. Same thing, if I am a receiver and then I make a decision in my mind, is this a conversation best I have one-on-one with this person? Or is this something I should have a third person in the room? Then I might say, would you mind if I have somebody else in the room? Okay. And these are just important, not because it's defensive, not because it's just that communication is fraught with risks of interpretation and misinterpretation. And therefore, just having another pair of ears in the room is very, very helpful. Something for us to consider as we do give or take feedback in our department. And you will see all this in our practice. And everything that we did is by design because we think through all this as much as possible. Now, how do we actually give the feedback? Location is very important. First of all, try and keep it as private as possible. It doesn't have to be a closed room. It doesn't have a closed door. Just make sure, remember, walls have ears. So just make it private, especially if it's something sensitive, something confidential, or if you think it's not so positive. That's okay, make it private. If it's really something really positive, praise in public. Let everybody know what a wonderful job that person has done. Let everybody, I think humans react well to praise. We like that positive reinforcement. When something has gone well, say, thank you for doing this. This is nice. And it's okay to praise in public, but generally feedback should be done in private. Now, if you're going to give feedback to somebody, just make sure it's constructive and meaningful. In order for it to be constructive and meaningful, in my mind, we need three pieces. One, we have to prepare for it. First, we need the information. What are we talking about and why and that kind of stuff. Try and back it up with data because the data is necessary in my mind for two things. First, the receiver may not be familiar with it or might want some more data to be convinced that what is being said is accurate and real. Okay, so have some form of data ready, or we can look at the data and say, sorry, I interpreted it this way. Maybe it means something else, and that's okay too. Whatever it is, it just helps with a nice two-way conversation. Because, in this meeting here, we have people with one of the highest levels of education possible. We have people with master's level, with doctoral degrees, and so on. So for this group of people, what really works well is convincing somebody intellectually, and nothing convinces somebody like data. Okay. And if you show them the data, I know you say this, but this is the data I have, and this is what I'm looking at. And let them look at the data. And if they have another interpretation of it, reconsider how you interpreted it, and then go back and forth and see whether we can build a consensus. So that's why whenever you give feedback, a lot of preparation goes into this. I would say to people, thank you for letting me know. Would you mind if I get back to you next week? Or can I talk to you in a couple of days? And it allows me to gather information. It allows me to get the data together so that when I talk to the person, I am really prepared and not really shooting from the hip, because it's not unfair to the other person. And the most important thing is how we frame the feedback. Okay? Feedback almost always have to be framed positively. Humans react much better to a positive framing than negative framing. Okay, we learned this with raising children. Okay, and we can even frame failures as stepping stones for success. We're all humans. We all make mistakes. Okay, the only difference between people who come ahead and people who stagnate are people who learn from their mistakes and use the stepping stones for mistakes. Next time the situation happens, next time the environment, they're that much smarter. And again, we do this in surgery, we do this in clinical practice. This is nothing new to any of us. But when it comes to administration and so on, we need to remind ourselves it's the same process that happens again and again. That's why we have QI conferences, because even the best of surgeons, the most experienced of surgeons, get complications. And then we look back and say, why did this happen? What did we do? And what can we do better? So feedback is no different from what we already do. And the other thing you guys are all familiar with is the sandwich method. So when we give feedback, there are several ways to do it. But basically start off with something positive, then give them the feedback, and then end your feedback with something positive. This is very important because once the person, the giver, loses the receiver for one reason or the other, then the meeting or the feedback cannot be as effective. And that's why one of the methods they recommend is the sandwich method. Feedback has to be direct because there cannot be innuendos. There cannot be, too subtle, because then the message may not come across. Again, we risk the risk of interpretation. So it has to be direct. And then the way we communicate has to be positive. For example, let's assume we walk into a clinic and we have a medical student, and the medical student did a nice history and physical, but there are opportunities for improvement. What we don't want to tell the medical student, you did this well, but you could have done this as well. That doesn't generate a good reaction for the medical student. Remember, the stress level for the student is very, very high. He or she is probably on one of the early rotations and they're trying to learn it. So what you want to do is, you did this fine and you could do this as well. So just using a and instead of but can make a big difference. So as we give feedback and so on, we just need to kind of think of where you're giving the feedback. Please prepare your feedbacks with information and data, and in your mind, how you're going to frame it. Use the sandwich method. Be very direct, because when the feedback is given, there cannot be ambiguity. This is it. This is what we are going to do. And then frame all failures as something that's positive. Okay. If we do that, then we can have a very, very effective feedback mechanism. Any questions or thoughts on how to give feedback? Now, to me, this is probably the most important slide in this talk. I use the abbreviation SLICK here. So this is, all along, we have been talking about giving feedback. I think what is most important in all our careers is actually receiving feedback. Remember, feedback is an opportunity that helps us to do better. And I told you, I'm undergoing coaching now to try and learn. We'll do a 360 to see what I could do better. And what this is all about is being slick. First is you have to seek feedback. If you don't seek, sometimes you may not be able to find out things that would be useful to you. Okay. So, for example, I tell this to our residents, if you do a clinic note at the end of the clinic, you can leave without even bothering to hear anything about the notes you did. Okay, that's one way to do it, and you'll be fine because you probably think you did everything right. And what would be a better way is another clinic, hey, to your attending, say, hey, have you had a chance to look at my notes? Is there anything I could do better? Okay. That resident who asks that question to the attending at the end of the clinic is more likely to learn than a resident who just walks away at the end of the clinic. Okay, so either way is fine. Is in my mind, it's a missed opportunity. So who is going to get a little bit higher, a little bit smarter, more out of what they did that day is somebody who seeks feedback. So that's the first thing you need to do. You need to ask people how things are going. The next thing is listening. And I can tell you, listening is an active skill, comes with practice. Unlike speaking, for example, as I'm talking now, I have taken time to prepare this talk for several months. I've reviewed it. I have prepared in my own mind, and it's a very active process. And my mind is extremely alert as it be, because I'm talking to a huge audience here or listening to every word that's being said. So when we speak, we are very alert. On the other hand, when we listen, we may not be. And that's human nature, okay? I don't know how many of you, as you're listening to the Zoom talk or looking at your phones or driving and focus somewhere else or looking at your laptop on another screen, all these things are barriers to listening, okay? And so listening is an active skill and we have to practice. The best way is try listening to a tune of music and see whether you can recognize it. play a slightly different tune and see whether you can hear a difference between the first tune and the second tune and tune in. And so words have meanings. And what I realized at our level, and as you move up your ladder, people speak fewer and fewer words, but then they are very pointed and very powerful. Okay. And it would be very courteous. It might say like, would you mind looking into it again? Okay. It could be that simple. Now, if we don't actively listen to it and look at the word, would you mind looking into it again? Every word has a meaning in there. Okay. And an active listener would capture it and then would react to it. A listener who's unable to listen, unwilling to listen, or just doesn't have the skill of listening is very likely to miss that kind of information. And then that leads to miscommunication in the future. Oh, you said that, I'm sorry, I didn't know that. Or oh, I did not hear that. It goes on and on. And one thing we all have to recognize is it's important that listening is a very active skill. And like anything else, we all have to practice listening. Unlike speaking, where it's given, we practice and so on. Okay. And the third thing is internal reflection. Okay. When we get positive comments, we feel good. Okay. Our gut, when we get less than positive, our gut reaction is, what the hell are you talking about? Why are you telling this to me? Okay. I've been working very hard. I have been doing this. I have been doing that. That's normal reaction. Okay, you don't want to, you've been working hard. You don't want somebody telling you some fault. You don't want telling somebody this and that. But the first thing is understand that's the reaction we all get. Okay, and how you manage this reaction? Keep quiet and reflect. Okay, absorb that information. One thing we all have to understand, it does not give the giver any pleasure to give not so positive feedback. That's the first thing we need to understand, because we are all good people. In social circumstances, I wouldn't even remotely say anything negative to anybody. I mean, I would. The most polite, always say please and thank you, never. For me to come across in a job environment and to say something less than positive or favorable to somebody is very, very uncomfortable for me. Okay. But it's a necessary process. So the person who receives it, like if I'm receiving a feedback from you guys, I understand how hard it is for you to give a feedback about a chair, about a program director or an attending. It is very hard for you to give a feedback. I understand that. So I have to respect that. If I think it's hard for me to get that feedback, imagine how hard it is for the giver. But that giver has taken time, has prepared, has information, has data, is framing it to the best of their ability to give us the feedback. And therefore, the least that we could do is to pause and internally reflect. Okay, and that's the key thing. And once you reflect, contemplate. Now, the person has given you information. You have listened to it very, very carefully, every word, irrespective of how it was said, the tone. Now, the words all have meanings, and that person has chosen to speak those words. Now you're reflecting it. Now you get all that information, you contemplate. Okay. Why are people saying this? Why am I not getting the best ratings with my patient? Why is my patient upset at that visit? Okay. What is it that I do? Or is there something in my mannerism that throws people off? And this is all hard because we just don't see ourselves. And we are full of blind spots in our lives. Okay. And every one of us. Okay. Other people are seeing a lot of things that we don't see in ourselves. Okay, so when we seek, when we listen carefully, we take time to reflect, we put all these things together, it will start to make sense. And then we let it kick in. Now say, you know what? I'm glad somebody said something to me. I'm making change. We listened to Amy early on this morning in our talk. That's exactly what she said. Okay, she listened very carefully. Okay, she was shocked when I told her that because she wasn't expecting it. She didn't say a word. She said, thank you for letting me know, because she made me feel comfortable, because I never spoke to Amy, anything that's anything uncomfortable. And then Amy said, and she went back and thought, and what she did, she contemplated on all that, change of behavior. Then in the last 2 years, I've not heard a single complaint about Amy. Okay, and she has been slick. And that's what I want you guys to understand. So not only give us a better person, we'll be happier on the job because people around you are going to like you now because you're listening to them, you're making changes, you're so much better, okay? And imagine if we all do this consistently, every time we'll have a wonderful team. Because remember guys, our lives are very, very busy. Interpersonal relationships can drain us dramatically, either in our personal lives or at work life. When we don't get along with each other, the emotional drain it has on us is terrific because that's all you're thinking. You're upset, you're mad. And then what it does is your brain can only handle so much. It's going to affect your work, okay? You can't say if you're a resident, if you got interpersonal friends with the team, then you're not going to study as well because you're mad all the time, or that's going to show. And the people we work with are extraordinarily bright people, okay? They're very perceptive. I can tell a difference between a resident who had a decent night's sleep the previous night or who did not have by the way I see them in the morning in the operating room or in the clinic. I just know they haven't rested well, or there is something else in their mind because we have been doing this for so many years. And so it's very hard to hide any of these things. The best way we can do it is to be slick about it, learn and be a better. It's not only good for yourself, for your own well-being, for your own productivity, but it's best for a team, okay? I again realize this is a very dry talk, okay? This is not metastatic prostate cancer. This is not some fascinating basic research, but this is so critical to what we do. I think it's important that we all understand why we do this and do it in the best way possible. Any questions? Now we talked about the virtues and the values of feedback. I want to take a moment, or a couple of slides to see why isn't this happening? Clearly there are barriers. And if it was easy, we would do it, wouldn't we? So it's important to understand the barriers. And then I'm also going to give you some tools how to overcome these barriers, okay? First is we'll talk about the barriers for the giver. Then we'll talk about the barriers for the receiver. Okay, the giver is the personality issue. That's the first barrier. And there is a personality trait in all of us. It's called passive aggressive. Okay, what this means, people continue to be upset about something, environment, work, but they don't say a word. It'll be calm, it's very airy, you know, it's just the person wouldn't say a word. And all of a sudden, there'll be an outburst, okay? And I can tell you, I suffer from this all the time, and I'm trying not to do that. And I have burst open in the past, okay? And I look at myself and I reflected back, why was I so passive when there were so many things that was bothering me about the situation? Why didn't I do something? I think first is I'm uncomfortable because the person I'm referring to, the situation I'm in, I just uncomfortable. I don't want to say anything. Then it happened once, twice, thrice. Now it's building up in my mind. I should have spoken or said something before it got to this point. But of course I did not. And then an outburst and then and then everything calms down. And this happens to all of us, okay? And we need to be aware, being passive is not healthy, okay? You have to then and there speak with give back. If you just build things and when it bursts open, it may become uncontrollable and there could be a lot of damage, okay? And that's why we all have to be aware that each of us in some way or other do have this personality trait. Unless we are aware of this, we will be victim of this personality trait of being passive aggressive, okay? Then, of course, the culture itself. If there's a hierarchy in the system, and believe me, you know, when we were residents, when we were fellows and all that, we never had an opportunity. Feedback was out of the question. You know, the chairman said this, the program director said this, you did it, or you're out of the door, period. It wasn't right or wrong. It's this way or done. And we as residents and fellows learned, if I had to complete my residency, if I had to complete my fellowship, that's the way I had to do it. Period. Now, that did lead to some amount of resentment, but on the long run, I have no resentment at all, nothing but gratitude, because these were old-fashioned teachers. You know, they were not administrators. They were just surgeons who became teachers. They didn't go to business school. They didn't think like business guys. Whereas if you go to a corporate sector, this is what they talk about all the time. What is the culture of Apple? What is the culture of Google? And what is the culture of another company? We have evolved over time. Even in medicine now, it's changing into a corporate industry. We need to inculcate this culture. We need to talk like business people, okay? So hierarchy is a problem. The second thing is fatigue. Fatigue could be both emotional, physical, or just tired. You know, you're given feedback after feedback and nothing is changing. Who cares anymore? Okay. Or you're physically tired. You know, you're just working hard. The last thing you want is to give a feedback. And these are barriers. The third thing is risk of retaliation. You know, if you give feedback and somebody doesn't like it, they're going to get at you. Unfortunately, we have systems and processes in place. Retaliation cannot happen. Okay, if you're not comfortable giving it, then there are confidential way of giving feedback in anonymity. Okay, but remember, the feedback has to be for the betterment. Okay, if the feedback is about getting somebody and all that, then there are going to be consequences because they can get back at you as well. So that's not what we are talking about. We are talking about how can I make the other person better? How can I make this department better? How can I make the situation better? How can I get more resources for the place? For example, you know, with the robotic program, one of the resources we want was the simulator. In a residence field that we should have it. We got some online simulator coming. We have had simulators come. Now we are going to have a permanent simulator on site. That's a resource. And that's a concern that the residents had, gave feedback to me. They said, look, Dr. B, robotic program is great. You're working at making us do on the console. We don't have a chance to train. They gave us that feedback. And I recognized that was necessary. But because of that feedback the residents gave me about the resources, then we have been able to get something more permanent here. We will be getting something more permanent here in the near future. We've done the paperwork and all that. And so I think a constructive feedback, and again, I want to reiterate, there would not be any retaliation for feedback. If it's negatively intended, then that's that's another way of HR issue that we need to deal with differently. As long as it's done with the betterment of the whole group of team, feedback is something very positive. And the last thing I want to talk about is one thing called the bystander effect. Now, one of the things that, I'm just going to give you a historical example. When there was a genocide going on in Uganda, and then one tribe killed the other tribe, and scores of people died in that massacre. And there was a researcher who went and researched into how can one tribe do this to another tribe? How can one human being go into a village and use a machete and nail everybody down and kill them, and women, children, and men? How can humans do this? Okay, they found out two things. They found there's some reasons humans do this. There's one of those few species on this planet which kills its own species. Okay, not for food or anything like that. It just kills. So homicide is something seems to be uniquely human. And the other thing is there were people watching it and did nothing about it. Okay, and that bystander effect is a major problem, because even though we are in the moment, we are seeing all this, it's not affecting me directly. Why would I bother? And we have to overcome the bystander effect. We have to say, yes, it doesn't affect me today, but the same thing can happen to me tomorrow, or same thing can happen to somebody I love tomorrow. Okay, and therefore it is important that I do something. Okay, so these are some of the barriers for the giver. And the last thing is what I call the cruising. Basically, this is true for the giver and the receiver. Things are going well. I've been doing this for a long time. I've been here for a long time. I know how this is all about. And therefore, you're disengaged from everything, because your little environment that you're working in is going well, hey, my research is going well. I mean, why would I bother worrying about getting another funding, or, my residency program is going well. Residents are happy, faculty are happy. Why would I bother, changing the curriculum? Why would I bother introducing a new topic? It's the cruising mode. And that is another barrier, because when things are comfortable going well, we don't want to ask or shake any questions. We always have to be thinking, what can we do better and how can we change things? Similarly, there are barriers to the receiver. First thing is personality. Unless, we all have a personality, and that's why we are unique, okay? We have to reflect on our own personality and say, what is the strength in the personality and what is the weakness in our personality? And then see whether we can work on our weaknesses. It's not easy because we are all hardwired in a particular way. It's like trying to change my accent. It ain't going to work, okay? But do the best you can and try try not to be resistant. And this is why you need to be slick when you get a feedback. And it could be relationship. That could be history, it could be a strained relationship. Now, human relationships are clearly very complex. And one of the things I learned, my wife is a painter, and then she would want to paint, say, a nice pink color, and I don't know anything about colors. She'll start painting her canvas black. And then she'll put another color on top of it, another color on top of it, another color on top of it. Ultimately, it'll be the pink color she was looking for. And I would tell her, why are you going through so much effort to get to the pink color? Why don't you just put a pink color directly? She said, no, if you want to get the right hue and the right shade, this is the combination. And she has a science behind it in terms of how she paints. And what that tells me, relationships with the current relationship I have with one person, X, Y, and Z, is a product of multiple layers of experience I've had with that person. Okay, so what meets my eye, the current relationship with that person, is the current relationship which can change in the future, but it's a product of multiple layers. It's the way my wife was painting. It is the multiple layers of paint that is behind it. I may just see the pink color in it, not realizing it all started with a black color. Okay, it may be black today or something dark that I don't like, but it would have started with a bright and vivid color, and over time, layers and layers of relationship had affected it. So it could be relationship issues. Sometimes you have to go peel back those layers and go back to the time when you had a healthy relationship with that person and see whether you can recap that and say, you know what, all these things happen that tarnished our relationship. Now we are having difficulty even talking to each other. Is it possible to undo some of the layers, go back to the time when you and I were friends and we could talk? Okay, these are complex human relationship issues, but we need to kind of work through this if we have to have an effective work environment. Okay, and the functional thing is not being slick. And then the other thing is, we talked about data. It is possible that you remain unconvinced. People can give you all the data. In your mind, it's not convinced. And therefore, this feedback doesn't resonate well with you. Or the quality of feedback. The person who's giving you the information has not taken time to think about the information, has not given you the right type of data, or just reacting to hearsays here and there that you're unconvinced. So you're basically not convinced with the quality of the feedback. And the receiver is also in a cruising mode. You know what, things going well, people say what they say, let me go along, do what I want. And this lack of engagement hampers progress because you're trying to do things better, and then you got a team of people who are just happy with status quo and go on. And this is just not at a department individual level, it all happens at organization level, national level, and so on and so forth. This lack of engagement and the cruising mode is a real challenge. Over the years, having done this leadership positions where I've been giving feedback to people and I've received feedback for at least now 15 years, if there's one thing I can narrow down, the biggest barrier to listen to giving or receiving feedback is listening. I would tell that person the same thing 100 times over, and they come back with the same argument again and again. And then I exhaust all methods of communicating with them. And the only thing I can say is, please listen to what I'm telling you. I don't know how else to break this barrier. It's a huge barrier. So as a receiver, I can feel that other people might feel the same thing about me. So that is one thing I need to work on. Pay attention, and it's an active skill. You have to practice every time somebody is talking to you. Drop what you're doing and listen to what that person is saying. So make life easier for everybody. Same thing, if somebody is telling you you're not listening, take that seriously, because that person is tired. They're trying to communicate with you, and now they feel you're not listening, and that's not a barrier. And once that happens, then we'll go to the next step. Okay, so how do we overcome barriers? First is, please understand your own personality. You have to have very good insight, what works well for you, what doesn't work, and communicate that with the people around you. Hey, so if somebody starts on a new job, one of the first questions I'll ask them is, are you open to feedback? Of course, everybody will say yes. And I'll ask them, how would you like me to give you your feedback? And most people will say, please let me know as soon as possible. Let me know. And that's all it takes. But some people may not say you that way. They might want to do it a little bit differently. Please take time to understand how that other person wants the feedback to be given. And then use skill set, use data, persuade and negotiate. Remember, all these things in negotiation is, if you don't ask, you ain't going to get. That's a failed negotiation. So you need to ask. And then you have to persuade. And persuasion can take multiple attempts. It may not happen right away. What you don't want to do is burn bridges. Just because you didn't get your way, that doesn't mean the other person didn't listen. It doesn't mean that your feedback didn't work. It's impossible to get our way every time. So you just need to use data, persuade, negotiate. You have to repeat it. Try and build a consensus. Ultimately, we are not going to get our way all the time, and the other person is not. We have to find a middle ground to work and always be slick and avoid the power of hierarchy. Don't tell me I'm a senior and therefore you're going to do this. Those things don't fly these days. I can't go tell anybody because of my power, my position, which I might have today, tomorrow I may not have. The powers can come and go, the titles can come and go, but the art of building relationship, the art of persuasion will never go away, because that's the most influential way to work with people. Okay. Now, if feedbacks don't work, what do you do? Okay. First thing is you agree to disagree. And then we have to say, okay, look, I've given feedback. We are not able to get through. What do we do? Then discuss what happened in the feedback and how do we feed forward. Let's try and resolve it at the lowest denominator possible. We don't have to escalate everything to the highest level. Okay, let's just work it amongst ourselves. Now, there may be in issues, you don't disagree on everything. There may be just one or two items you disagree. Take a moment to identify what the disagreements are. Even when you disagree, tell them, I see what you're telling me, but I'm not able to agree with you because of this. Articulate your stance, because we are reasonable people. I understand that I don't expect everybody to agree with me every time, but as long as I understand why they don't agree with me, that's better for me. Instead, the person just doesn't agree with me and I don't know why, and that's difficult, okay? So it's okay to disagree, and then just use these few things. And then when you leave, look, we worked hard on this. I'm sorry this is not working. Would we mind if we talk to somebody else? Or would we mind if we get an arbitrator? Would we mind if we go talk to an attending about this? We residents have talked about it. I'm not sure. Would you mind if we talk to an attending? Something like that. Build a consensus. So at the end of the day, it's really healthy way to move forward. Okay. And so just to take home messages, you got a minute or two. Remember that feedback is a constructive and necessary process. Please use this tool as frequently as possible. Be slick, actively seek feedback so that we all can improve. Be proactive giving the feedback. And the most important thing is be appreciative of the giver. The person giving you feedback has gone through a lot of thought process, even to coming and meeting with you. Be appreciative and make that person comfortable so that they are willing to do this now and in the future so that we can get better. Okay. Any questions? Okay, if there are no more questions, we'll try and end on time. And I'm happy to receive any feedback from you guys on this or similar topics. And unless you give me feedback, I don't know whether this is good or bad, and I might have bored you for an hour. I really don't know. I'm working in a vacuum here. Please help me to understand what do you think of these talks. Let Sharia know, or email me, or let Sammy know, and they will pass it on to me. Okay. Thanks, everybody. Have a wonderful day.